Hi, my name is Dr. Daniel Sullivan. I want to welcome you to our oral surgery practice. My partners are Dr. Rabah and Dr. Mohammed Erakat. We basically want to review the post-operative instructions that our staff and our doctors are going to give you. This goes for most of the oral surgical procedures that we perform here in our practice, whether it's placement of implants or removal of teeth. Okay, so you'll be given a bag. This is the bag, and this bag has a few things in it. One is an envelope with usually with your receipt, and prescriptions are in here as well. Even though the prescriptions will be called into your pharmacy, we also provide you with the written form of the prescriptions. So you'll find in this bag here are the post-operative oral surgical instructions, and there are a few components that we're going to go over here. Additionally, these are on our website, so if you go to our website you will find all these instructions, but we do provide this trifold for you here with all the instructions.
Hello, this is Dr. Erakat, and I'm here to talk to you about what to expect after your extractions in terms of bleeding and also when you could resume normal activity. So after every tooth extraction, it's very normal to have some bleeding. The bleeding could last for a few hours up to a couple of days. It's nothing to worry about. We give you lots of extra gauze to take home, and all you have to do is fold up the gauze, put it over the extraction site, and bite down with constant pressure for 20 to 30 minutes at a time, and that will significantly slow down the bleeding. Now also what happens after you get your tooth extracted, your mouth still keeps making saliva. So if even one tiny drop of blood mixes with the saliva, it all turns red. So some patients get worried because when their saliva comes out, they think they're bleeding a lot, but in reality they're not. It's just the saliva mixed with the blood. So again, take the gauze, fold it up, put it over the extraction site, and bite down for a good 20 to 30 minutes. If you feel that the bleeding is lasting a little longer than it should, you could take a tea bag, fold the gauze around it, and then bite on that for 20 to 30 minutes, and that will also help with the bleeding.
Hi, how are you? This is Dr. Rabah. Today I'm going to be talking to you about swelling and diet after a surgical procedure. One of the main things that we always expect to happen after any oral surgical procedure, which might even either include an implant placement or extraction of a tooth or extraction of wisdom teeth, is swelling. Swelling is usually expected to start the day of the procedure, and it peaks 24 to 48 hours after a procedure. And it's usually, I always tell my patients not to be surprised if they notice more swelling the day after or 2 days after the procedure. One of the things that we give our patients to decrease the swelling is ice packs, in which will be given to put ice on for 15 or 20 minutes, off for 15-20 minutes, the first 24 hours on the surgical site area from the outside, just to help decrease the swelling and the irritation that might be happening around the area. We also give medications. In certain cases, we give medications which do help out with decreasing the swelling also.
Is it possible that you can get what we call a post-operative infection, an infection after the surgery? Yes. The incidence is very low if you do good oral hygiene, as we'll talk about, and you take the antibiotic. Now, some patients we will give an antibiotic to, some patients we will not. It's not everyone gets an antibiotic. It depends on your specific case. If you take antibiotics when it's not needed, you can develop a resistance to antibiotics. So we don't want that. That's why we use antibiotics judiciously, only when you need them. But antibiotics will prevent against infection.
Since swelling is going to be present for at least 2 or 3 days after surgical procedure, we're always going to expect some limitation within the opening of the mouth. Our patients are not going to be able to chew really solid or hard foods versus not going to be able to open the mouth really wide, and therefore it's always recommended to start tailoring the foods to softer diet. Anything that would not involve much chewing, and anything that would involve just placing in the mouth and almost swallowing immediately. And there's a really big huge range of foods which are starting with almost full liquid foods to soft mechanical foods that can be used.
The other thing we need to talk about for your post-operative instructions are medications. You may or may not, depending on your situation, be given medications. Most of the time we do give some medications. One type of medication we give is what's called an analgesic, a pain medication. You may have gotten Vicodin or Percocet for pain. That is typically used for breakthrough pain. Both those medications have narcotics in them, so you have to be careful. You cannot drive while taking Vicodin or Percocet, okay? So you do have to be careful, but those are medications that your doctor may have prescribed for you. The other medications that we prescribe sometimes are anti-inflammatories and what we call an NSAID, non-steroidal anti-inflammatory, such as Motrin. That's a great pain medication and a great anti-inflammatory. So we ask you to follow the instructions on the Motrin as well as instructions given to you for pain medications such as Percocet or Vicodin. The other medication that you may have been given is an antibiotic. If you're not allergic to penicillin, most of the time we will dispense amoxicillin. Or if you are allergic to penicillin, many times we may give you something called a Z-Pak or a medication called clindamycin. You should follow the instructions given to you. It's in your post-operative bag that we give you for each medication. Another medication that we may have given you, especially if you had 4 wisdom teeth out or in minimally invasive procedure, is Decadron, and that is a steroid. Does not have the negative effects that you may have heard of with some steroids, but it's just for swelling, and we usually just give 4 tablets, and it's just to be taken for a day or 2. Again, you would follow the instructions on the prescription. For the most part, those are the medications we give. If I give these medications to patients, I ask them to normally finish all the medications except for the Vicodin. And when do the patients start taking the medications? I like the patients to start taking the medications when they get home. An hour after they get home, they can remove the gauze, have a little food, and then take medications. Most medications you should take after having some food, or at least take it with food. But again, you should follow the specific instructions given to you by your doctor and or pharmacist. The other thing to prevent infection is good oral hygiene. I mentioned before on this video, we ask our patients the day of oral surgery, the day you get oral surgery, do not rinse your mouth, do not brush your teeth. We don't want you to spit, okay? But the day after the surgery, we want you rinsing with warm salt water 3 to 4 times a day for approximately a week, okay? The other thing that you can do to keep your mouth clean is we give you a syringe. This is like a water pick. You take a cup of warm salt water, you put this in there in the cup, and you pull this back. This will fill up with warm salt water, and you shoot this in the extraction site. Do this after meals. So gargle with warm salt water after meals and use this syringe. That will help keep everything clean. The other thing you can do, what you should do, is use a soft bristle brush and brush your teeth. But again, Do not do these things until the day after the surgery. So that's basically how you keep your mouth clean. Do what you normally do for your oral hygiene, but also rinse with warm salt water and use this syringe.
In terms of resuming normal activity, it really varies from person to person. It also depends on how many teeth were extracted and how difficult the extractions were. In general, if you have one tooth extracted, most patients are good to go back to work by the next day or by the third day. If you have a more involved procedure like having your wisdom teeth extracted, it usually takes a few more days, usually 3 to 4 days. Most patients like to wait the full week and then go back to their full activity. If you play sports or have a very demanding physical job, then it's good to wait the full week before resuming any sports or any strenuous activity.
So in summary, these are the post-operative instructions you should follow. Please feel free to refer to our little trifold here with the post-operative instructions. It's very complete. This information is also on our website. Our staff knows this information very, very well and be more than happy to review it with you. And please don't hesitate to call our office. Thank you.